Thank you for the invitation to make this presentation about the situation in Denmark or where we are, and thank you for the difficult question that you ask. We have tried to put together a short introduction to where we are in the Danish healthcare system and what the European health, or to have that as a basic for discussion about what the European health data space will be or will have to build on, and this presentation is a joint effort between MedCom and sundhed.dk, so between Janne and me. So it should cover the most part of how the Danish infrastructure is built. Just to set a little the scene of when we are talking about creating healthcare data and the use of them in the different healthcare systems. We all have different governance models and healthcare structures that is part of the determinants of what we can do and how data is formed and established. And in Denmark is a three-level healthcare infrastructure. You could say we have the government, the state level. We have the 5 regions that is in charge of the hospitals, and then we have the 98 municipalities that are in charge of the home care, rehabilitation, and prevention, and so on. And they are all, let's say, their work is all transformed into organizations that are dealing with their healthcare data and the healthcare infrastructure. At the state's government level, there is the Danish health authorities that is in charge of the overall framework for the work. Then we have the regions, the 5 regions that they have their regional health organization that is the practical collaboration organization between them. And then we have the governments, the local governments of Denmark. That organization is responsible for the data generation and the governance around that on the municipality level. And then we have in Denmark, you can say the two organizations that is trying to build all this together. We have the window to data, that is sundhed.dk, which is the national health portal. That is where you can, as a citizen or a healthcare professional, get access to data across the sectors and see all the information that the healthcare system, or most of the information that the healthcare system has on you, or has on the patient that you are treating at the moment. So that is electronic medical records, prescription, lab results, and so on. And then we have MedCom, which is the other national organization that is, you can say, the key in all this about data establishment, because they are in charge of the standardization for the communication. They are having the responsibility for both the semantic and technical interoperability between the different systems in the Danish healthcare system. And as many of you know, this has been running for a number of years, and is well established. Denmark MedCom is also responsible for the security infrastructure for the Danish healthcare system. And if we go on, so we have a number of players, national, regional, and locally, that is working with this and how to create the data. And then we have the national organization that puts us all together, and all this is done and has been done for many years under the framework of a national IT infrastructure. And this is to say this is not, I think, so different from all other countries or regions in Europe. We all work with our local environment as the basic for the generation of data. So we have currently a national eHealth strategy that has the focus on creating a trustworthy healthcare network for all, and the trustworthy is the key word here. It has to be secure and safe and reliable. We also, in the Danish context, always have been focusing on a multi-vendor environment, which means that we have open market approach to the suppliers, and then we of course are working with the standardization of the interfaces as a key to secure the market approach to that. So what happens when we are talking about the European health data space, and that it has to build on and has to interact and coexist or be fed by local and national data generation. In the Danish context, and I think that's not different from any other regions, is all start with the clinical needs and the healthcare professionals' needs for getting data for their daily work. In Denmark, that's the starting point of everything. And then traditionally we have had a number of long-term tradition of having a consensus process that builds the clinical content and the clinical agreement, and that is then, you could say, the next step translated into standards for the exchange of the data and for the content of the collaboration between the different sectors in Denmark. That is then certified for all vendors by MedCom, so that we are sure that what is exchanged is the right thing and is done in the right way. And then it goes into a local or national implementation process where all the local players, the regions or the municipalities are involved. And then it should then, and has been then, daily practice. That process of standardizing the data and the communication has led to the situation we are today, where we have very huge opportunity for using these data because they are so well described and so trustworthy. So we use that data that has been generated in that process for giving the citizens access to their own data. They are used for different kinds of apps for the citizens, but also for services on these apps with specific targets. But it's also feeding the national databases and national registers, both quality databases and registries for reimbursements and so on. And then it also creates the national medication record and the national service platform. And you can say that is where the European health data space starts to interact. That is on the premises that we all in countries and regions in Europe has some kind of this data standardization process done, and we are also using our data already for a number of different things, and they are determined by the use of in the local healthcare system, and that's the legacy that we bring into the discussion of the European health data space. What we have seen is that, at least in Denmark, the success factors for this process has been, you can say, a combination of bottom-up and top-down approaches, where it starts in the bottom with the citizens and their needs, either as patients or as citizens. We know that doing all this takes a lot of time. We always started with small projects, but as we normally say, it's always with the world domination at the end goal. So we think big, even though we start small. We have this time-consuming and sometimes difficult co-creation and consensus process where we involve all the relevant stakeholders. And we really has had the learning that you have to really stay focused and be determined to get to your goal. And then you can say the overarching premises for all this has been that there is a governance and a finance structure that has made it possible to do this. So there is national funding and there's regional funding around that is joined together to ensure this process could take place. So we see a lot of perspective, we see a lot of possibilities in the data that we have in the Danish system, and we see how we can use them for different new services and possibilities in the future. One of the, not surprisingly, new areas that is really upcoming is the patient-reported outcome, using the patient's experiences as own data as part of the decision and process in the Danish healthcare system, getting new types of data into the system and into the decision process. We will of course increase the access to information as we get it. We see for the patients now, we see and I think this is also a learning point from the COVID-19 is that the track and trace. It's important for people to know where in the process are their information, where in the process are their referrals and so on, so they know what to expect. And then we all have learned a lot of COVID-19, and we have all been under huge pressure in the IT part of the healthcare system to provide new services to the citizens when it comes to the COVID-19 passport. The next thing we are facing is probably a vaccination certificate, and at least for sundhed.dk, it has meant that our portal has crashed a number of times due to the number of citizens that has been logging in to see the test results. We have had an increase with more than 1,000% of users. It wasn't quite built for that. But also we see for the healthcare system, we see new opportunities. We see how the new standards are more flexible, faster, and safe. We definitely will focus a lot more on real-time data for quality assurance to make the clinical services better adjusted. And then the whole issue about research on real-world data and the secondary use of data is a huge potential as we get more and more accessibility to data. And because we started it all with a clinical consensus process, a strong, rigid standardization, we know the quality of the data. And that is, you can say, what we then bring into a further European health data space. A long process with a lot of people involved and a lot of discussions taking place there. That was
thank
from
you.
the Danish perspective. Thank you.